Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. Sorry if there is any mistakes in videos or shorts. Today we will cover the radiovisiography known as RVG, most important question for both PGs and UGs. First, you have to make an index. Starting with introduction, radiovisiography RVG is a digital imaging technique used in dentistry to capture and display X-ray images electronically. It has revolutionized dental diagnostics by providing high-resolution images with reduced radiation exposure and immediate availability. RVG encompasses various technologies including charge-coupled devices, complementary metal oxide semiconductor sensors, and photostimulable phosphor plates. These marked the transition from traditional film-based radiography to digital systems, offering significant improvements in image quality and diagnostic capabilities. Coming to the history, the first digital intraoral sensor introduced in 1987 by Dr. Francis Moy. Over the years, advancement in the sensor technology and software have led to the development of more efficient and user-friendly RVG system. Coming to the technological advancement, the first generation in 1987, the initial digital sensors were based on charge-coupled device technology, which directly converted X-ray photons into the electronic signals. That was also known as a Mark 1. So Mark 1 original digital radiography system which did not incorporate a microprocessor. Its technology based on early digital hardware likely using charge coupled device sensors. They provided 256 gray levels for image display. Although it offered high resolving power, the lack of a microprocessor limits its processing capabilities. Also, it has a high cost, bulky sensor size, lack of advanced processing capabilities due to the absence of microprocessor. Then second generation in 1994, the Digora system, which we will discuss later, introduced the photostimulable phosphor plates which stored X-ray energy and released it as a light when scanned by a laser. Its technology include the photostimulable phosphor plates, the first iteration of the second generation system, incorporating a 32-bit software-driven central processing unit. The Mark II system introduced PSP plates which stored X-ray energy and released it as light when scanned by a laser. Despite improvements, it lacked the memory to full utilize the sensor chip's resolving power, resulting in only 64 gray levels on the monitor screen compared to 256 in a Mark I. So when there is a higher grayscale, lower contrast which use in differentiate subtle changes in soft tissue and also enhance the detail and clarity of the images. The advantages are easier handling and storage, reusable plates, lower radiation dose and improve image quality, but it has limitations. Required an extra step for scanning which added time to the process. Despite improvements, it lacked the memory to fully utilize the sensor chip's resolving power, resulting in only 64 gray levels on the monitor screen compared to the 256 in Mark I, and its image resolution, while improved, still wasn't optimal and the plate were more susceptible to scratches and damage over time. But there is an improved Mark II, enhanced version of the initial Mark II system available as a mobile unit in some countries, and the improvements are addressed some of the memory and performance issues, providing better functionality and mobility. Then the third generation in 1998, complementary metal oxide semiconductor sensors were introduced, offering improved image quality and reduced radiation exposure compared to the charge coupled device sensors. We can also say that advanced second generation, a more refined version of the Mark II incorporating further advancement. So it is known as a Mark III system or advanced second generation, a more refined version of the Mark II incorporating further advancement. It used a technology which is more advanced CMOS technology with enhanced microprocessor integration, and the function provided even higher image quality, faster processing and additional feature like image enhancement and better integration with dental practice management software. The advantages are superior image quality, reduced radiation exposure, faster processing time and more user-friendly interfaces. Limitations are continued high cost and need for ongoing technique and technical supports. It has also a standalone version and the PC version. So standalone version is a development in the RVG system designed to operate independently. It has a features like include advanced imaging processing capabilities, improved resolution and greater memory capacity. And PC version is another advancement designed to integrate seamlessly with the computer system, offer enhanced image quality, faster faster processing times and better integration with the practice management software. Then there is a fourth generation in 2000s. So it is advances in software and hardware integration led to more efficient and user-friendly RVG system. Use technology enhance software and hardware integration. Advantages are more user-friendly interfaces, better image manipulation and enhancement features, and integration with practice management system. Limitations are continued need for updates and potential technical issues. The hardware was becoming more sophisticated, requiring regular maintenance and updates, which could be costly and time consuming. And the fifth generation, which is used presently, modern RVG systems such as a cone beam computed tomography CBCT provided 3D imaging capabilities, offering detailed views of dental structure with minimal radiation exposure. The technology uses cone beam computed tomography and other advanced digital imaging techniques. The advantages are superior diagnostic capabilities, minimal radiation exposure, and enhanced treatment planning with 3D imaging. Limitations are high cost and need for the significant technical expertise. CBCT devices are expensive and not all practices can afford them. Additionally, the complexity of the interpreting 3D images requires specialized training. Coming to the components of RVG system, the first is X-ray generator. So the function is produce X-rays by accelerating electrons and colliding them with a metal target. Components: high voltage power supply, X-ray tube, collimator, and control panel. Second is the RVG sensors. So it is a radio sensitive sensor. It has a size 1, which is for the regular periapical radiograph, and size 2, which is for the bite-wing and periapical radiographs. Also, it has a active surface, non-reactive surface, and the USB 2.0 connector. The function is captures X-ray images and convert them into the digital signals. Now, this RVG sensor itself has components, which is first scintillator, fiber optics, CMOS or CCD sensors, and hermetically sealed housing. So, scintillator converts the X-ray photons into visible light photons. It is essential for creating an image that the sensor can detect, since X-rays themselves are not directly visible. So it's work on the principle that when X-ray hit the scintillator material, it emits light in the proportion to the X-ray exposure. Then the second is the fiber optics. These fiber optics transmit the light from the scintillator to the sensors. It ensures that the light signal is efficiently and accurately transferred to the sensor or without significant loss or distortion. When the optical fiber guides the light photons from the scintillator directly to the sensor, maintaining the integrity of the image. Then CMOS and CCD sensors, they converts the light photons into an electronic signal, complementary metal oxide semiconductor known for lower power consumption and faster readout times. Then charge coupled device known for higher image quality and sensitivity. So they are the heart of the RVG sensor. It captures the light image and converts it into a digital signal that can be processed by the computer. And then hermetically sealed housing. This hermetically sealed housing protects the internal components from environmental factor like dust, moisture, and physical damage, ensures the longevity and reliability of the sensor by keeping it free from contaminants and damage. The housing is sealed tightly to prevent any external elements from affecting the sensitive component inside. So the sensor has a reactive side that captures the X-ray photon, which are then converted into the light by the scintillator, and the light is transmitted to the fiber optics to the sensor, where it is converted into the digital data. Now, analog to digital converter. So it converts the analog signals from the sensor into a digital data. The components include electronic circuit that process the analog signals, then the computer system which store, process, and display the digital images, CPU, RAM, storage devices, and specialized radiography software are the components. These software include the image enhancement tool, patient management system, and communication interface for sharing images. Then display monitor. Display monitor shows the digital images for the analysis and diagnosis, and the components include high resolution monitor with the calibration for accurate color and contrast representation. Positioning device that helps in correctly positioning the sensor and patient for optimal imaging. The components are bite blocks, aiming rings, and the other accessory to ensure consistent and accurate positioning. Then communication interface, which transfer the digital image to the systems or the devices. Components include USB ports, network connection, and wireless communication modules. Then power supply. It provides electrical power to the X-ray generator and other components, and the components are batteries or external power source, voltage regulators, and power distribution units. Protective gear, they ensures the safety for both the patients and the operators, and components include the lead apron, thyroid collar, and protective barrier of the X-ray generator. Maintenance and calibration tool keeps the system in the optimal working conditions, and the components are cleaning kits, calibration tools, and diagnostic software for troubleshooting. Coming to the image acquisition and processing, means how the RVG works. So first, image capture. The electronic sensor is placed in the patient's mouth and X-rays are directed at it. The sensor captures the image and send it to the computer. Then analog to digital conversion. The analog signals from the sensor is converted into the digital data using this analog to digital converter. Then image processing. The computer processes the digital data, organizing pixels into a coherent image. The coherent image in RVG is one that is clear, accurate, and free from artifacts or distortion, and this ensures that the detail of the teeth and the surrounding structures are well defined and can be used effectively for the diagnosis and treatment planning. Then image display. The processed image is displayed on a computer monitor and allowing for immediate viewing on the analysis. Coming to the advantages, so it reduces the radiation exposure. RVG system significantly reduce the patient's exposure to radiation compared to the traditional X-ray system. Instant result. Digital images are available immediately, eliminating the need for the film development and reducing the patient's wait time. High image quality. RVG system provide high resolution images with the better contrast and detail, making it easier to detect dental issues. Then image manipulation. Digital images can be easily adjusted for the brightness, contrast, and magnification, aiding in more accurate diagnosis. Then storage and sharing. Digital images can be stored electronically, reducing the need for physical storage space and making it easy to share images with the other healthcare providers or specialists. Cost effective. Over time, RVG system can be more cost effective as they eliminate the need for the film, chemicals, and processing equipment. Versatile applications. RVG sensors come in a different sizes and can be used for various type of dental examinations from pediatric to adult patient. Coming to the disadvantages, the initial cost. The initial investment in RVG equipment can be high, which may be a barrier for some dental practices. Training requirement. Dental professionals need to be trained to use RVG system effectively, which can require time and resources. Technical issues. Like any digital system, RVG system can experience technical problems such as the software glitches or hardware malfunctions, which can disrupt the workflow. Maintenance. Regular maintenance and calibrations are required to ensure the system continue to function optimally. Dependence on power. RVG system rely on a stable power supply, which can be limitation in areas with unreliable electricity. So overall, RVG system offers significant benefits in terms of image quality, patient safety, and efficiency, but they also come with some challenges that need to be managed effectively. So coming to the conclusion, radiovisiography has transformed dental diagnostics, offering enhanced image quality, reduced radiation exposure, improve patient care. As technology continue to evolve, RVG will remain an indispensable tool in the modern dentistry, providing dentists with the tool that they need to deliver the best possible care to the patients. These are the references. Stay tuned for the next part, which include the Digora system. If you want this PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll send you the PDF. New videos on Thursday evening 6 p.m. and Sunday morning 11 a.m. Also, we try to put MCQ according to the topic on every alternative day or every week on our shorts with the answers and explanation if needed, which will help you in a Viva or NEET exam. Like, share, and subscribe the channel. Thank you.